Hi, my name is Dr. Prasad Rao. I'm a hospitalist. I work at Kennestone Hospital here in Marietta. I'm 56 years old and I've been working there since 2012. And my job, like I said, is a hospitalist where I look after all the patients once they're admitted to hospital. So COVID-19 is a virus, and it belongs to the group called coronavirus based on its structure. It's round and it's got these spicules on the outside, so it's almost like a corona around the virus. That's why it's called the corona. Now there are different types of coronaviruses. There are some which affect humans for many years, but usually it just gives you a fever and cold. There are some animal coronaviruses too, and usually they stay only in animals. But this time it jumped to humans, so they gave it a new name. COVID means coronavirus disease. So the virus itself is called coronavirus 219 because there was another coronavirus which gave us the SARS. It's basically the same type or the same group of viruses. That was earlier, many years ago, and now it is COVID-19. So it's the second coronavirus which is affecting us, and 19 is the year in which it started. So COVID-19 is the actual virus, and then the COVID is a coronavirus disease starting in 2019, so 19. That's what they gave it the name. So coronavirus, just like most other viruses, especially like the flu virus, it is spread through what's called droplets. So when somebody sneezes or coughs, those small droplets stay in the air for many hours, and as long as the droplet is there in the air, the virus can survive. So the droplets are slightly bigger, so they can actually fall to the ground, and then it dries up, and then the virus dies after a few hours. But if it is really tiny particles, which you can't see, it's called airborne transmission, which is also one of the means of transmitting it, and that can stay in the hours for many in the air for many hours. And in fact, they did a trial and found that it stays in the air for at least 3 hours. But that was the duration of the trial. It might probably stay longer. So if somebody is in the room, you have to take extra precautions. The best method to prevent spread is distancing oneself from each other. So when I'm speaking, without knowing there are small droplets coming from my mouth, you can't see it, but sometimes if you see people against the light, when they are speaking, you can see tiny droplets. So even while talking, we can get droplets, as you can when you're coughing and sneezing as well. So the further away you stand from the person, the less chance that these droplets will reach you. That's why they've suggested that you stay at least a minimum of 6 feet from each other. One of the other ways it can spread is also by landing on surfaces, and when you touch it, and if you touch your face, it has to enter through the mucous membranes of the nose or mouth. That's why they say do not touch your face, because we will involuntarily or even voluntarily touch a lot of things. But then if you wash your hands with soap and warm water, you can actually kill the virus, which is why the constant reminders to keep washing our hands, because then we don't transmit it to ourselves even from surfaces. Now I have to wash my hands with soap for 20 seconds. The good thing is you don't have to touch this. So got the foam between the fingers, under the nails. I had a shower, but I'm just being a little careful. Between the fingers, the back, remember? That's like 20 seconds. Now I'll drill the drill. The virus dies with the soap, so that's the good part of it. Alright, so make sure the whole thing is clean. So my hands are clean, so I can touch this, clean the basin, turn it off. Right, now we're good. Now I feel clean again. So it's either from somebody else coughing or sneezing on our face, or even talking, or alternatively it's from a surface where we transmit it ourselves. Well, I'm taking a lot of precautions every day. First at work, because I'm in the hospital, so it's a slightly high-risk environment. So I'm wearing fresh scrubs every day when I go in. I'm not wearing any civilian clothes. Once I go there, I've stopped wearing the white coat because that's something you don't wash every day, so we stop using that. As I'm seeing patients, even if it's a non-COVID patient, we're using the hand sanitizer frequently. You'll probably come across hand sanitizers all across the hospital once every minute or 2 minutes, and we are using it as we walk around just to clean our hands in case we've touched something. And then when going into a patient's room and coming out, we are again using sanitizer. And as much as possible, when I see a basin, I'm using warm water and soap to clean my hands as well. At the end of the shift, just before coming home, I wipe down everything, all my equipment, that is my stethoscope, my phone, my wallet. I'm taking minimal things, that's all I'm taking. I wipe everything down with a sterile wipe, and then just before coming home. And when I come home in the garage, the rest of the garage is kept empty. I park on the far side, and I take off my shoes there itself because the shoes are a vector, it can carry things. I leave it there. So that half of the garage can be considered a little dirty, whereas this half of the garage is clean. So then I come in my socks and I go straight into the washroom, and everything that I wear, top to bottom, everything goes into the washer. There's nobody here at the time when I come in. And once I put it into the washer, I'm not touching anything. I'm just loading the washer, and I go straight into the shower, which is directly across the corridor. And then once I shower, have a proper warm water shower, then I feel clean. Hi, how are you doing? Just coming back from work. Was in hospital all day. Now I'm going to practice safe techniques to keep the infection outside the house. First, I need to put a few things into the back because I'm not taking anything with potential infection on the side. I've stopped wearing the white coat because you keep wearing it over and over again. So no more white coats. I'm also not wearing the regular clothes, just scrubs. So I can put it into the washer as soon as I come in. I actually do have shoe covers which I use when I go into the high-risk rooms, and I throw them out. Plus they have given us all the protective gear which I leave it in the hospital. I don't bring any over here because they are not clean right now. So let me take off my shoes. So after this I'm going to go straight to the washer room so I can put all my clothes into the wash. But before I go in, I kept a hand sanitizer here so that at least my hand is clean when I'm touching the knobs and things. So this car is what I'm using now to go to work. I'm not changing the cars, so I'm trying to contain infection there. The other cars are for personal use at home or after I've cleaned myself. So now this half of the garage can be counted as dirty. That's why the shoes are right there. So I come in my socks, which I hope are clean, and I go into the house. So now my hands are clean because I've used the hand sanitizer, so I can use it to open the doorknobs. I close the garage, I'm going to make some noise. And I'm going into the washroom so I can put all of these for wash. But before that, I'm just going to keep these things here so I don't want them to spoil in the washer. And I've cleaned all of these before coming with the sterile wipes. So these are all clean, but I'll clean them once more after I have a shower. I mean, I've kept a hand sanitizer and some more disinfectant wipes over here. So here I go. This is the washer. I touch it on the inside and everything goes in. So I have nothing. And I go directly across to the shower on the same floor. try and minimize spread anywhere else. That's when I come back. As far as when we are living here, the only other contact we have with the outside is for groceries and essentials. So for that, we are now asking them to deliver the goods at home. But even that is touched by somebody else. So for non-perishable items like cans and bottles of food, we keep it in the garage. We just take it there and leave it there for 3 days. So it's like a quarantine for it. Whereas vegetables are washed completely, then dried outside, and then we refrigerate it. We're now back from Kroger. So I'm going to take everything inside. And the stuff we don't need right away, I'm going to keep over here and let it decontaminate itself. But for anything in the fridge, we'll have to keep it in. So we'll have to. These are also just nuts and cans. I can keep them here. They don't expire. Like, they don't need refrigeration. Like I said, the stuff which doesn't need refrigeration, we've left it outside. But the things which need refrigeration, I'm just wiping it clean. The rest of the thing, I'm going to decontaminate it outside itself. Just with time. This I'll have to keep it in. And then once I'm done, I'm throwing all this directly into the recycling. Not keeping it in our stash. We don't want that. And I'm going to wipe the table clean as well. The area where we kept it. With a disinfectant wipe. Try to be as clean as possible. I suppose it works within limits. Yeah, there we go. So we're trying to minimize as much as possible contact with the outside, but whatever contact we have, we're trying to be as sterile as possible. So social distancing is the phenomenon where we try and stay away from each other, which is contrary to what we've been doing so far. Because as humans, we are social animals. We like to gather in groups. We like to talk and exchange ideas. But social distancing is just physical separation. Like I mentioned earlier, we need, the further away we are, the less the chance of spreading infection from one to the other. So if you go and meet somebody, even if somebody it's my neighbor, I've known him for years, but one of you could be a carrier without symptoms. Either I could give it to him or he could give it to me. And then I infect so many others, and those people infect so many others, or vice versa. So to prevent that, you minimize contact with everybody. So that's what social distancing is all about. Even if you have to go out for essentials, keep a 6 feet distance from the other person. That is the advice given by the WHO and most governments. So social distancing literally means a physical distancing from each other. You can still talk to each other on the phone. The virus does not travel by social media and the phone. So.
ಮೋನೆ ಪಂತು ಉಲ್ಲೇಖನ ನೇವರು ಆಯ ನಮಗೆ ಎಪ್ಪಲ ಜೆತ್ತು ತಿಕ್ನ ಪಂಡ ಅರ್ಥಾನ ನಿಕ ತುಡು ಎಪ್ಪಲ ಕೆದೋನ್ ತಿಕ್ಬೇಕರೆ doing nothing.
People are having virtual parties on the phone, which is great as long as you do not meet anybody. Well, the social distancing, when it's been announced here, unfortunately it's not being followed as much as one would like. It's great to see that there's not many people on the road, not many cars, but there are still cars on the road. One of the things that concerned me was when I was going to hospital, I go by Kennesaw Mountain, which is a national park, and because it was a nice day and it's sunny, a lot of people were going there up for a walk. And while they've said you can walk outside, but if you have so many people in a group, then the whole principle of staying away from each other is gone. So the only people who should be walking together is the immediate family, because you're living together. But everybody else has to be at least a meter and a half, 6 feet or more apart, which is difficult when there are a lot of people. So walking outside really means walking alone rather than walking in groups, or at least when there are a lot of people. So that's one thing we've got to be aware of. But moreover, even when we're going out, just go out for essentials. Do not just go out for anything else. And even if you can minimize the number of times that you need to get groceries, for instance, make a list and plan ahead so you're not repeatedly going, so you decrease the number of contacts with everybody. So this whole virus is new. We don't know much about this virus because it's literally just jumped from animal to humans. So we do not have a test for it. Just like we have a test for some of the other diseases, we did not have one. So it took some time to come up with a test. You have to start from scratch to come up with a whole test. The test itself is just a swab. The swab is easy. You just put a cotton wick in the nose and throat and send it down to the lab. But after that, the reagents required, that's where we either did not know what to use or we did not have enough. And since then, a lot of companies in CDC and Public Health Department, and also now many of the lab companies like Quest and LabCorp, these are all national companies, they've all started doing it. So the testing has become much easier now, but you still need a physician's order to get tested. So that's we are at that stage right now. There are a few drive-through facilities, but we don't have any nearby. I know that South Korea had a lot of drive-through where you don't even go into an office. You sit in your car, they come and take your test, and they'll text you your results. So testing is important because it gives a sense of urgency. Now, if you do have the COVID, then you have to be a very strict quarantine at home, not even stepping out anywhere. So testing is also important for epidemiological reasons. So to see how many patients we are actually exposed, and then you can get an idea of how many patients are actually getting sick and how many are getting even more critical. So testing is important at multiple levels, but it doesn't change our treatment dramatically whether we are tested or not. So if you have, say, like a fever and a cough, it could be anything. It could just be a simple flu. It could be COVID. That because we don't have active treatment right now, nothing changes. So you go to a hospital, they'll test you, but if you're fine, except for a fever, they'll send you home. The only reason you need to be admitted to a hospital is if your oxygen level is low and you need oxygen, or you're sicker than that. So if you have a fever, one of the best things to consider is it could be COVID. There's nothing else you're going to do for it. Just you do social distancing and isolation and quarantine like they have suggested for COVID, because it also works for other viruses like the flu. So testing, while it's important for us to know, it is not that important in terms of how we treat. Moreover, the current tests are not 100% sensitive. The sensitivity of the current test is about 70%. So if people have disease when they come into hospital, our treatment algorithm remains the same whether they test positive or not. So where people put a lot of emphasis on testing, it doesn't matter. However, it does matter in one aspect from an epidemiological standpoint for the community, because they can test and trace. So if you have one person, then they can ask them, where did you go? And then look out for those other people and try and catch them early to quarantine them, not to treat them. So the whole business behind this is test to identify, trace it to the other people, and contain it by quarantining them so nobody goes out. We can already do that even without a test. We just don't need to go out. That's something we need to practice very strictly, and that's what's going to help. Well, so far, it started first in China, and of course, China clamped down very, very hard at the time. They had imposed a curfew right from the beginning. That is the way to do it. This disease, you cannot do this in stages, because once it starts to spread, it's already spread if you have not caught it in the beginning. So you can't introduce one legislation in the beginning and then the next one and then the next one. Everything has to be done in the beginning. So China did a very good job of that, and they were able to contain it despite the population being very, very high in Wuhan. And now, since then, 2 other countries have also joined it. India has done a 21-day social distancing ban. In other words, nobody gets out of the house. It's being enforced pretty strict, with the police on the street, physically getting people back to their houses. And just today I heard that South Africa is also doing that, where they do not want people out on the street, because these are highly populous countries, and in the absence of very strict measures, this thing can spread very, very fast and become a catastrophe. So I think they've done the right thing by clamping very hard. So China was the first, now it's India, and now it's South Africa. None of the European countries and America has not done it yet, of a total ban on going outside. So when people do ignore medical advice given by scientists, it is very distressing. One of the things they have said is please practice social distancing and isolation. And then when people are on the beach, just because it's spring break, it infuriates me. These are young kids, and they may just have minimal symptoms, although we have some younger kids now who are on ventilators, but most of them may just have simple symptoms like a cold. The problem is they're going to carry it back home and give it to all the elderly people and the people who are susceptible, and then they're going to spread it among their friends who will carry it back home. So the growth can be exponential again amongst people who are more vulnerable. So even though nothing happens to them, they will be responsible for the death of a lot of people just because they did not listen. I understand that Australia has since closed the beaches. Not sure if Miami has officially closed the beaches yet, but I'm hoping that the message goes through. I've not seen any more newer pictures of people on the beach, but I know that there are still people about. So that has to stop. A few misconceptions about the COVID virus is that it's not going to affect us for whatever reason. For example, you think that it may not come into our country, but the COVID virus does not know any borders. There's no difference between class of rich and poor. The COVID virus does not care. It affects everybody. And remember, you don't need to touch anybody to get it. You just need to be around them. And if it's on a surface long enough, for example, when you go outside and touch touch a railing somewhere, if somebody has been there, you could get it. So this disease is going to affect us all, at least most of us. And we had that in the beginning, thinking that it will not come to our country, but it is here already. So the only way we can contain the spread of this is by social distancing, which is what we're doing, and we should enforce it even more. And without that, we are going to see a big surge in these infections. We have not yet reached the peak, so we do not know which way this is going to go, but at least we can change the course of the disease by preventing this huge surge. Because when you get a surge of illnesses together, a lot of people coming into hospital, the hospital systems can't cope. They don't have enough beds, they don't have enough ventilators. But instead of a big surge, if you're able to flatten that curve, which is what they keep talking about, then the number of people coming to hospital at a given time is not much. And you can spread it out a little bit, but that's something we can cope with. The mortality comes down. So that's why with the COVID, please do not think it's not going to affect us. It is here already. This is not a simple virus. It's extremely contagious. So we have to be very, very careful. The best way of doing it is not going out unless you have to. And it has to be either your work related, where you cannot work from home and your physical presence is required. Like I have to be in hospital, I cannot work from home. But for anybody who can work on a computer and get your job done, that's where you need to be. Like schools and colleges are closed because you can learn online, and that's what people are doing already. But there are still some people out on the street who really shouldn't be there. As long as that stops, then we should be okay. And together we should be able to conquer this virus. Now, last thing is that there is a very nice statement by the WHO, which was announced today about what you should do and how to stay healthy while you're indoors. It's on their website. There's also a short video. It's worth looking at about how we should exercise, eat healthy. One of the interesting things is they said, just for a mental well-being, stop listening to the news all the time because it gets a bit depressing. Just get your news once a day or twice a day from reliable sources. Remember, there's lots of fake news going around on social media, which frightens people and is unnecessary. So don't listen to all of that. Go to reputed websites or reputed news channels. Don't stick next to the TV all day because it's just depressing. There's nothing to be gained. For you to be updated, you can check it once a day. That's all that we need to do. What we need to do and what's going to change is social distancing and isolation. That's what we need to do. So it can be a bit boring when you cannot go out of the house, but there are other ways to keep ourselves occupied. We used to always make fun of people coming to a restaurant and all of them are on the phone and social media. Guess what? Stay at home and use the social media. Talk to all your friends. You don't need to go out. People used to complain that somebody watches too much TV. Guess what? Watch to your heart's content, but stay at home. Don't go out. So staying at home and using social media to contact people is nice. It is nice to contact people. Keep in touch with your neighbors and friends by social media, not by meeting them directly. And also you can do other things, like you can exercise. Exercise is good because it boosts immunity. That's what we want. So there are most of exercise websites and even gyms all have online free lessons right now. Even big companies have opened up all their things to be free. So use all those apps, exercise at home. There are various levels. Any kind of exercise is healthy. If you have a backyard, go out for some fresh air. Fresh air is always good for you, but if there are people around, you get back in. You don't want to be near that. And also follow the local restrictions. Some places allow you to come out on the street, some places don't. The less we meet people, the better. So you have to use common sense as we go along. But there's lots of stuff we can do. We can learn to cook. We can exercise. We can use social media. We can watch movies. There's lots to do at home. People having parties from home through social media. It's a virtual party where 3 or 4 people get together through an app, and then everybody's having a party and chatting. It is important to keep in touch with others, so we can do that as well. So there's lots of stuff you can do. And then, like the WHO chairman said, that this is the one time when the whole of humanity is coming together closer, and I think we can do that. And we should be able to conquer this virus, and then we should be able to have a healthy life after that.